The Basic Healthcare Provision Fund was enacted in the year 2014 under the National Health Act by the Goodluck Jonathan's administration to ensure the provision of universal health coverage for the people that are indigent in the country at least, and to ensure that health facility is built in each political ward. 1 year down the line, after a previous report revealed that the Basic Healthcare Provision Fund was not doing well in Ebonyi State. Let us see how some of these facilities are faring after 1 year. Primary Healthcare Center Ibego in Izzi Council area of Ebonyi State, which had few beds, one mattress on the floor of the male ward, and lacked water, drug shelves, solar light and fridge in 2022, now has family planning commodities, suction machine, replacement of their broken delivery couch, 2 beds in the postnatal ward, solar light and fridge, sufficient beds and mattresses, functional motorized borehole, 2 new community health extension workers, among other innovations. The nurse midwife and officer in charge of the health facility, as well as some community members and clients, narrate the success stories at the PHC and expressed satisfaction with the service delivery.
It is by the help of Impact. They came in, they provided a bed with mattress, they provided the borehole running 24 hours, the Basic Healthcare Provision Fund, they provided the solar light for us, and the EFSHA, they gave us capitation that we used to buy drugs for the women, children. They can access the facility, access free medical care. So that is how the miracle can tie your visit.
Yeah, but you can come to this place and treat yourself because there was a card they shared to us that time. So after when you treat yourself, finish, they will register, they will mark the card and leave you free with the drugs.
This is my first time, so but I can say everything is okay.
Primary Healthcare Center Ebonyi is another health facility in Izzi Council area which had unconducive wards, few beds, and had no toilets except the one still under construction in 2022. The health facility now has toilets and bathrooms, motorized borehole, solar light and fridge, as well as influx of clients for varied healthcare services.
Thank God, many things has changed. As you can see, we were able to have this drilled motorized borehole by Impact. Then we have procured many equipments also by Impact. Then the basic rights has helped. We have built toilets.
They take care of it by telling us to come for their immunization and inject them very well.
The story is not different at the Maternal and Child Health Care Center Okposiomawara in Ezza North Council area, as the Basic Healthcare Provision Fund has enabled the facility to receive 2 additional trained nurses, rebuilt their broken fence, expanded the wards, and purchased new foams and seats.
The BACBF are trying. Before they posted me here, we have many lapses here because our gate is 4 by left and right. The first quarter we use it to face our walling that fell down. Because without this volunteer health workers I am employed, which I'm paying them through my own purse. So I wonder what I'm seeing here. The hospital is already turning to the general hospital. We need manpower so that the work will not be overloaded us.
In short, before the pregnant women are running out of this health center, they are going very far away because no people, no capable hands to take good care of them. But now we are not paying much money to deliver. Just delivering is free.
Maternal and Child Health Care Center Ekaba in Abakaliki local government area, which operated in a medium-sized 2-room apartment and one adjoining mini hall for immunization, and lacked water as well as human resource for health, also had the challenge of being situated in a Kaba market where the hospital shared space and toilet with a Kaba market as at the year 2022. This year, 2023, the facility has been able to complete the construction of a consulting room with the help of BHCPF and also acquired more instruments, additional beds and qualified staff. However, the challenge of sharing space and toilet with a Kaba market is yet to be solved.
Because of the help of the Impact project, we've been able to acquire more instruments than before. For instance, we have additional bed, and they also approve some other things like roofing and having another structure, a little one there. But that one will now come the second phase of the Impact project. Then we also have additional staff with the help of the Basic Health Fund.
Maternal and Child Health Care Center Azuyoku in Abakaliki local government area, which had almost everything needed by a standard health facility in 2022, has also increased in every area, including having adequate manpower and increased attendance of clients.
This year, our client flow, especially in labor, have increased to 140 for some months. Children immunization have increased to the extent that if you come here on Monday, it will look as if to say you are in Ogwete market or international market because of the number of people that you will see in this place. No matter the number of women that comes to this place, we can never record out of stock. They must see the drugs to go home.
Their services are very okay, and since when I got the health insurance card, I've been making use of it, and free medication whenever I come for antenatal is free medication whenever I show them the card.
As part of measures to tackle lack of human resource for health in selected primary health care facilities in Ebonyi State and also maintain their regular payment, Ebonyi State government reduced the number of ad hoc nurse midwives employed in 2020 to 80 to enable the government pay them adequately. In addition, the National Primary Health Care Development Authority embarked on a policy called Expanded Midwives Service Scheme, EMSS, implemented by an organization known as SIDANI that oversees the employment and deployment of nurse midwives and community health extension workers. So far, the organization has employed about 68 ad hoc nurse midwives and community health extension workers on one-year contract basis.
I've been here for quite some time, and as my oath of allegiance, I vowed that a nurse midwife, to the best of my ability, to provide quality of care, especially the pregnant mothers, to make sure that the rate of maternal morbidity is reduced or comes to standstill in Ebonyi State.
I was employed 2020 by the state ad hoc, Ebonyi State ad hoc nurses. That was in 2020, all right. But then we were not being paid, so we protested, reported to the governor. Then did all we could. Then, though they later shoveled it to 80% of us, they took about 80, just 80 after 200 and something. They took about 80 and dropped us without being paid. So luckily for me again, EMSS, I saw their adverts online, so I applied and I was called for the interview. Everything just went well. I got the job again. So currently I'm working with EMSS, and I was posted at Goto Health Center, where I'm currently working now. So the EMSS, they have been so good, trying, just that we are only hoping that they shouldn't be like the state ad hoc that we did. So we just hope that they will be able to pay us accordingly Yeah, if they should be able to pay us accordingly so that we also can give our best at the health center.
This improvement has led to increase in the data of antenatal, deliveries, immunization, and other services in most of the health facilities, resulting in 1 to 5 deliveries per month in MCH Ekaba, 17 to 20 in MCH Okposomorara, 10 to 25 in PHC Igbego, 50 to 120 in PHC Ebonyi, as well as 100 to 140 for antenatal and 150 to 200 for immunization at MCH Azuyoku, all in the year 2023. Despite the remarkable improvements recorded in the health facilities, most of them are still in dire need of more human resource for health, office expansion, provision of water, security, and under-maintenance work. Responding to the issues, successes, and challenges revealed by this report in primary health care facilities across Ebonyi State, the Desk Officer, Basic Healthcare Provision Fund, Ebonyi State, Leonard Alego, Executive Secretary, Ebonyi State Primary Healthcare Development Agency, Dr. Emeka Philip Uvoba, and Commissioner for Health, Ebonyi State, Dr. Moses Ikenna Ekoma, commended the state governor for embarking on aggressive reform of the health sector and also spoke on the implementation of the Basic Healthcare Provision Fund and other projects in the health sector.
There has been a remarkable improvement in terms of implementation of Basic Provision Fund in the state. And one, in terms of infrastructure, we are on maintenance now. Generally, the improvement in the service delivery has also multiplied in terms of attendance to the facility. So our facilities now receive huge attendance of clients, especially in terms of attendance to facility, also what we call OP, out of patient attendance. Then we also have delivery and also ANC attendance. So these have increased because of this improvement. So our people at the villages now patronize our facilities because they all that are needed to make sure that the facilities are working, are in place. Not that all of them are in place, but at least we have reached to some level. But the national, one of the conditions for participating in Basic Health Provision Fund is for each state to pay 25% of the worth of their work plan each year to augment what the national has given. So actually we have not received our own. The National Primary Care Development Agency, the State Primary Care Development Agency has not received our own for the year, but we believe the State, His Excellency, State Governor, has started very well. We learned he has paid out of the State Health Insurance Authority, and we believe also that our own will soon be paid.
Ebonyi State Primary Health Care Development Agency and our primary health centers has gotten enough improvements over the years, and currently it is something that all of us should be happy about. Even though we've not gotten to where we want to get it to, we are still planning to make it better. The counterpart fund that Ebonyi State need to pay for us to benefit maximally from the national primary health care, and all the partners have all been paid. And based on that, so many activities are going on in our primary health centers. The Basic Care Provision Fund, the third quarter we just finished. The employment of health workers, I think this is the first time it is happening. The government of Ebonyi State, led by His Excellency, immediately entered office in declared state of emergency in the health system.
When we came on board, we have to go around to assess our health facilities. What we discovered were nothing to write home about, and the problem, we categorized it then into three major groups. The group A, we have the problem of manpower, problem of no basic equipment, and that of drugs. So, and you know, there is no hospital without professionals, without medical equipment, and without drugs. So we started from there, and His Excellency, being interested in the sector, approved the recruitment of health staff to presently in the secondary health facility. That of the primary health facility is still in the process. The issue of drugs, we discovered the way the drugs were being purchased. We were not happy, quickly proposed a bill to establish a drug management agency, and that bill has been passed by the House of Assembly and signed into law by the present governor. So with this present bill now, what we intend to do is that all the purchase must be from drug manufacturing companies. By that way, it will be cheaper and will be sure of the quality of drugs.
One interesting innovation discovered in the course of this investigation, which has aided the success recorded in the health facilities visited, is the Impact Project. This Impact Project is a World Bank loan introduced by the National Primary Healthcare Development Authority to augment the deficiencies in the implementation of the Basic Healthcare Provision Fund in Nigeria. According to the desk officer, Basic Healthcare Provision Fund, Ebonyi State, Leonard Alego, Ebonyi State government paid the counterpart fund of 100 million naira to kickstart the project in Ebonyi State this year, 2023. In Abakaliki, Fortunate Ozo, NTA News.